Okay, we are we are recording. I'm gonna start letting people in. I'll admit myself in. I have no idea. Hi, everybody. My name is Kathy Murphy, even though Mary Ann, you are showing up as me. It is so weird. It was okay. Mary Ann Salvatore Lori is here, who's one of the
Hello.
advisors. So I was wondering how I was letting myself in, Lori. So or Marianne. Interesting. So anyways, it's 11:59. We're going to give it a couple of more minutes as people are coming in. I appreciate everybody who was here early. Totally appreciate coming in early because I do not have that gene. We're really excited to talk about emergency preparedness for home care clients, incorporating climate change, emergency preparedness into the nursing curriculum. And that is what we're going to do today and highlight Lori Lopez's project here at Charter Oak State College with emergency preparedness for home care clients who are on waiver programs, which she will give far better detail than me. Genevieve, where are you from? And Heather, you can
Hi, I'm at Purdue Northwest in Indiana.
wonderful. Is this your first time to a climate change call or an environment education forum call?
I was able to be on the last one, and even
Okay.
today I'm going to have to leave early, but I wanted to support.
I appreciate it. And this is recorded so you can dazzle your friends and relatives and catch up with anything that you missed. So welcome. Are you faculty, Heather?
Yes,
Or okay. In what type of program?
it's as a BSN program.
Okay. And who's your accrediting body?
We are under ACEN.
Okay. Our program is AACN, so we can commiserate about different accrediting bodies. But I am going to talk about both of those in a minute or two. Genevieve, how about you? Mhm. All right, we're going to get started. I am not the best at Zoom, so I apologize from the very beginning. Much better in Teams, but we will get this done. So I have a combined PowerPoint. My plan is to just go over some of the basics about why climate change and emergency preparedness is so important in the nursing curriculum. And then Lori's going to be talking about her capstone project, which demonstrates the application and I'm going to say mastery of this content, which I'm really appreciative of. Okay. I share and go here and go here and go here. So I am assuming that you see one slide, right, Lori?
Yes.
Perfect. Yay. Okay. So as we talked about, the title of today is Incorporating Environmental Health and Climate Change into the Nursing Curriculum, which from the very beginning of my working with Annie for 15 to 20 years has become my passion. And so the big questions I want to talk about today is why it's important and how do we do it. So my go-to always is the Nursing Scope and Standards of Practice, last updated in 2021. And there's several quotes here that really do demonstrate that it is the core of what we're supposed to be doing in nursing. We promote community and population health by advocating for social and environmental justice, community engagement. We understand and actually we know that place matters because of societal determinants of health and the environmental impact of where people grow, learn, work, and reside. And I want to say play. Standard 4 talks about the mitigation of environmental or occupational risks. Standard 12 talks about advocating for all aspects of human and environmental health in practice and policy. 17, which is one of the components that I talk to my students in the clinical area. Again, I try to do this from the very beginning in their nursing career, is resource stewardship and really doing judicious use of supplies as they're stocking rooms and those kinds of things. And Standard 18 talks about the registered nurse practices in a manner that advances environmental health and safety. So one of the reasons why I was asking about what body accredits your nursing program is because the two major ones, AACN and ACEN, look at this a little bit differently. I have had the privilege, and I'm going to say pain, of just going through accreditation for our nursing program at Charter Oak State College, and our accrediting body is AACN. AACN utilizes the essentials, and it very specifically talks about environmental health. And from that, you can also talk about climate change. Standard 1.2C talks about demonstrating social responsibility as a global citizen who fosters attainment of health equity for all. Standard 2.4, diagnosing actual or potential health problems and needs. 2.5, developing a teaching plan. And 3.6, advancing preparedness to protect population health during disasters and public health emergencies. Identify changes in conditions that might indicate a disaster or public health emergency. Understanding the impact of climate change on environmental and population health. And describing the health and safety hazards of disasters and public health emergencies. So you can see that when we're writing our accreditation report, we need to specifically say how we're meeting these objectives in our curriculum. And Lori's project will definitely demonstrate all of these. AECN also in 5.3 talks about contributing to a culture of provider and work environment safety. 6.3, using knowledge of nursing and other professions to address healthcare needs. And 9.1, communicating effectively in individuals. And one of the things that AACN is talking about, and I'm going to say it badly, but when we're looking at our competencies, which is the next milestone that we need to do, when you look at a project such as this, all of these meeting these criteria can be clustered for a student instead of doing it one by one. I'm going to say a skill sheet where you check off that the student has done one thing. We can utilize all of a project such as this to demonstrate competency in so many of these areas. So ACEN, which was the accrediting body for the program that I left, doesn't specifically talk about environmental health or climate change. But what it does talk about is that we need to include a general education courses and concepts that enhance nursing knowledge and practice. A program may integrate environmental science, public health, policy, social determinants of health under general education to support nursing practice. And what it really talks about is that if you say you're going to do it, that if it's part of your curriculum, then your resource room is going to demonstrate and show all of those exemplars of how you do it. Um, Things like requiring the curriculum to incorporate contemporary concepts across the learning environments, DEI, social determinants of health, evidence-based practice, research, scholarship, information literacy, interprofessional collaboration and delegation, professional identity, and scope of practice. Criteria 4.9 talks about if environmental health related content involves in community-based practice, public health, and population level interventions, they may be included in practicums or community clinical experiences. And again, I think about my former program, we spent a lot of time talking about mass casualties. I am in a area that is very industrial. So our go-to was, a manufacturing plant blew up, something like that. But let's look at climate change, or let's look at extreme weather events and think about protecting our clients, especially when our students are going into the community, because our clients may be home alone when something happens. It might be a significant snowstorm or flooding. Just last night at the news, I could think about there were two or three specific weather events that they mentioned. Standard 5 by ACEN talks about the graduates meet end of program outcomes. And again, if you choose to include those, we need to be able to write about them and say how our students are meeting them and have that knowledge. More importantly, or as importantly, faculty need to have the relevant expertise in public health, environmental health, community health, and policy if the program includes those content areas. And I think Annie is the perfect place to help faculty develop that expertise between mentors, the e-textbook. And I'm going to give a little shout out to the e-textbook right now, which, if you know, it's on the Annie website. It's a free online textbook for people to download, utilize in their classes as a resource for their teaching. We're just starting the work for the fourth edition, so that if anybody is interested in contributing into the fourth edition, feel free to contact me. So what ASIN does not require, it doesn't mandate that you have to teach environmental health or planetary health. There's no standard that it has to include it. Um, but the other thing is, if you're saying that your foundational documents are the scope and standards of practice, it is mentioned in the scope and standards of practice. So one of the things that my program, Charter Oak State College, did was accept the Climate Challenge School of Nursing commitment. I'm very proud to say that we were one of the first schools in Connecticut to join, and a majority of the schools in Connecticut now have joined. The six community colleges in Connecticut, most of them have joined. They have a common curriculum, and environmental health is in their curriculum specifically. Charter Oak is Connecticut's public online college. We have very high quality, flexible and affordable, and we are an RN ADN to BSN program, which allows our students to be able to complete their degrees with all of the commitments of being, most of my students are new graduates, so balancing work, new work commitments, family, and other things that we have to do. We are a fairly new program. We started in 2019. And we are growing every day, and I'm really proud of our outcomes. One of the other opportunities that we have for incorporating environmental health and resources for climate change is SIGMA, the Nursing Honor Society. We can write journal articles and share the information that way. There's conference presentations. I'm proud to say in March 2026, I had an abstract accepted for the national conference in Washington, D.C., where I'm going to be talking about utilizing the e-text as a resource for the nursing curriculum. Sigma also has a climate and health community, which is a great listserv where people are asking questions, looking for resources, and there's nurses who have expertise that are more than willing to help and share information. There's also grants and scholarships available not only from a national organization, but with local chapters as well. Charter Oak is a member of the Iota Epsilon at Large chapter here in Connecticut, which is a combined chapter with the University of Hartford, Central Connecticut State University, St. Joe's, and Charter Oak. Some of the examples of projects that we've done, which I would like to say are under the auspices of environmental health, um, is there's a prom coming up in May, and we are doing collections of prom dresses to donate for children in foster care for them to be able to have dresses for prom. One of the things I just did was I probably just fixed about 15 dresses that came from a dress shop that were in need. They were a little sad that they had been tried on a bunch of times and needed a little bit of work. So instead of those dresses being thrown out, they've been repaired and now they'll be able to be utilized for this event. One of the other things is consideration events. If you want to look for me, have 50 bottles of bottled water somewhere. But we have a tea each spring, and we have the most eclectic group of teacups and saucers. And so that is our business meeting and our spring meeting where we're using fine china at our tea every spring and minimizing waste. So as I talked about, there's a few resources here. Annie is a great resource. We have the forums of education, practice, research, policy, advocacy, global climate change, food and ag, and regional forums, which are geographically around the United States, so that we're hoping that people who live in nearby regions maybe have some common areas to work and those kinds of things. So please look at any of those, all of those, and consider joining them, especially if you're thinking about continuing your education and maybe going for your master's or your doctoral degree, because the research forum might be a great opportunity for you to get assistance as you're continuing. Again, the e-text is a great resource. Sigma, there's also the Global Consortium of Climate and Health Education. You've got the CDC, the EPA, and the Climate Resilience Tool. And there's many, many more. And so next I want to introduce you to Lori Lopez, who is a graduating senior here at Charter Oak State College, and she is going to be talking about her capstone project and share with what she's learned and also share the resources with you.
All
Lori,
right,
it's
so
all yours.
hi everyone, I'm Lori Lopez, and I want to thank you all for the opportunity to share my project. So my capstone project is titled Bridging the Gap, Empowering Nurses with Emergency Preparedness Tools for Home Care Clients and Waiver Programs. And this project stems from my experience in home care, where medically fragile clients are often unprepared for emergencies. And this isn't due to lack of willingness, it's because they lack tailored, accessible education and structured planning tools. So, in response, I created a nurse facilitated preparedness toolkit designed to empower both clients and caregivers to plan confidently and effectively. Go to our next slide. So, what is emergency preparedness? So, emergency preparedness means planning ahead for events that could threaten health, safety, or access to essential services. And while the ANHE community is well versed in these principles, I put this slide in here because medically fragile home care clients often lack sufficient support, resources, and structured planning needed to apply these concepts in real life. So we lost our slide there, but at that point, while we get the slides back up, I do have a poll for everyone, and you can just write your answer in the chat. I'd like to know, where do you primarily practice? Those of you that are here with it, are you in academia? Do you do direct patient care? If you just want to post in the chat where you're currently practicing. Excellent. So I see a lot of academia. So we can move on to our next slide. So who are waiver program clients? And some of you may be familiar with them, others may not. So the focus of my project was specifically home care clients who receive services through state waiver programs. These individuals represent one of the most medically fragile and underserved populations in home and community care. So waiver programs were designed for people who would otherwise require institutional level support, meaning they often live with chronic illnesses, mobility limitations, or dependence on electricity powered medical equipment like oxygen, suction machines, feeding tubes. So, understanding their needs really helps explain why a customized nurse guided preparedness approach is so important. So, we're going to do another little poll now. And I want to know what everyone thinks here. What additional supports might a home care client need during an emergency that standard materials might often overlook? And you can put your answers in the chat. Generator is great. So many people don't have them. Exactly. Accessibility, transportation. Exactly. We can move on to our next slide, which is slide number 4, and it's going to talk about some of the things that you posted in the chat. So why are waiver clients different? Waiver clients face risks that standard preparedness materials don't fully address. And because routine nursing follow-up isn't part of the waiver program and emergency preparedness plans are not a requirement, many emergencies end up being handled reactively instead of proactively. Clients who rely on electricity powered equipment, like you said in the chat, they're at high risk during events, even if it's a short power outage. Transportation barriers, like you said, can limit their ability to evacuate. And then with them, they usually have caregivers, so inconsistent caregiver schedules can leave them alone during a crisis. Some clients also struggle to receive or understand emergency alerts due to health literacy or language barriers. And there could be hazards in the home, like unclear address numbers, cluttered walkways, or hard to reach exits. These can all delay EMS response and they can also block evacuations. So all of these factors really show why these waiver clients need a nurse-guided, individualized preparedness plan. Moving on to our next slide. So many of these waiver clients, as we said, have access and functional needs that affect their ability to stay safe during an emergency. These can include communication challenges, mobility limitations, specialized medical needs, or reliance on daily support. Clients with limited English proficiency, or those who depend on busy caregivers, they often need extra time or they may need help to even complete a preparedness plan at all. People who use wheelchairs, walkers, oxygen, other assistive devices are especially at risk when the power goes out, as we've said. Or they're also at risk if they have a daily caregiver and that caregiver can't get to their home during a snowstorm. What do? Others may need transportation options, medication plans, or specific dietary supplies. So recognizing all of these needs helps to ensure preparedness plans are realistic and usable. So this is why a one-size-fits-all plan doesn't work. Preparedness needs to be individualized and guided by a nurse who understands the client's whole picture. So I'm going to do our final poll here. And this is, when you think of emergency preparedness, what type of emergencies come to mind? And again, you can post in the chat. Flooding, fires, tornado, blizzards, explosions, earthquakes, exactly. So if we go on to our next slide, when most people think of emergencies, they think of natural disasters. Preparedness isn't just about hurricanes or wildfires or floods. It's about events that don't make the headlines, heat waves, snowstorms, or just an extended power outage. So these smaller scale disruptions are often the ones that most severely affect homebound clients. So recognizing and preparing for these day-to-day emergencies can truly be life-saving. So we're going to go on to our next slide. And I have a couple of case studies that I wanted to share. So the first one is Miss G. Now, Miss G was a client. She lived alone. She had a PCA that came in every day. One day, this was right around Christmas time, her PCA decided she wasn't coming to work that day. So Miss G did not want to wait to put up her Christmas decorations. Miss G, who has a tendency to get dizzy and pass out, went up her attic stairs, gathered her Christmas decorations, and proceeded to walk down her stairs, at which case she got dizzy and passed out and fell down the flight of stairs. Luckily, she did have her emergency alert button. She was able to press the button. However, EMS were delayed in finding her home because she didn't have a house number on the outside of her home. It took them a considerable amount of time to find her. They eventually went to the neighbor's house, and the neighbor was able to say, oh no, that's the woman that lives next door. And while she ended up being okay in this scenario, it could have been a lot worse. So it just shows the need for preparedness. Another client I work with, Mr. R. Mr. R actually had a great preparedness plan. He was one of my clients who felt he was prepared. However, he was oxygen dependent. But as he explained to me, my neighborhood never loses power. My power lines are underground. We don't have to worry about a pole getting knocked down or having power lines down. We've never lost power. Well, sure enough, a few years ago, the power went out. And Mr. R thought the power would come back on soon. It did not. And his oxygen saturations continued to drop. And by the time they reached the high 80s, he needed to call 911. He was transported to the hospital so he could receive supplemental oxygen. So each of these cases really show how preparedness, or the lack of it, can really directly impact survival, recovery, and the independence of these patients. So moving on to our next slide, we are going to talk about the toolkit. So the central product of my project is the Emergency Preparedness Toolkit. This is an evidence-based resource. It's designed to make preparedness education practical and achievable. The toolkit includes a household assessment to identify risks and readiness gaps. It has a go bag checklist. It has fillable client templates for emergency contacts, equipment lists, and action plans, and more. It has a QR code you can see in the corner there linking to this educational PowerPoint, as well as all of the documents. And it also includes a sample binder that nurses can model for their clients. And these tools make preparedness visual, interactive, and easy to customize. The sample binder is great. It takes a fictional client and it addresses every single one of her needs, from herself to she has a child to she has a service animal to her medications. And it shows just a scenario for her. So if clients are wondering, what would I put in that box? They have an example of what someone else put in that box, and that's going to be really helpful. Moving on, we can go to our next slide. The toolkit goes far beyond the basic checklist, though. It also includes a summary of the client's medical conditions. It includes their current medications. It has any power-dependent equipment they use. It also covers emergency contacts, transportation plans, in the nearest safe shelter or backup location. Communication plans are built in as well. Who will check in? What to do if the power fails? It also addresses caregiver coverage, since gaps in support can quickly become emergencies. And all of this is organized in one place to help ensure safe, continuing care during any crisis. Moving on to our next slide. So why is this different? What makes this project different is that it fills a major gap in preparedness planning for medically fragile clients. Plenty of public resources exist. I went through tons of them doing the research for this project, and they explain how to build an emergency kit, but none of them are really designed for waiver program clients or for clients who rely on medical equipment or timed medications or daily caregiver support. And as I said before, there's no policy requiring individualized plans for this population. So the generic materials that were out there often missed their needs entirely. So this toolkit changes that. It provides a nurse-guided, evidence-based binder that pulls all essential information into one place. At first, the binder may look overwhelming because it has absolutely everything but the kitchen sink in there, but clients can choose, hey, this doesn't apply to me. They can leave that section out. If it applies, they include it. And this is going to help nurses integrate preparedness into everyday care so clients can plan realistically and not with one size fits all materials. Moving on to our next slide. So another key feature that I want to bring up is the home safety and accessibility assessment. This would have been great for Miss G had she had this toolkit prior to her fall. This is completed at the first nursing visit. Many waiver clients live alone or rely on one caregiver. So this assessment helps identify safety risks early and ensures that EMS can locate and enter the home quickly. It looks for clear house numbers, safe entryways, plans to secure their pets, and realistic evacuation plans, especially for clients who may use walkers, wheelchairs, or stair lifts, and because those are all essential. Backup power is also addressed because it's critical for anyone who depends on electricity-based medical devices. Options may include portable power banks, extra batteries, or generator access. Medication preparedness, equally important, making sure each client has a 7 to 10 day supply. And while many preparedness plans do say that, they don't take into account plans for items that require refrigeration, while my toolkit does. It also talks about reliable communication tools like charged phones, alert systems, language appropriate materials. And these help clients receive and understand emergency information. And finally, it's going to connect clients to local emergency resources such as disability registries, accessible shelters. And these ensure that they have safe options if evacuation is needed. And it also includes a list of resources at the end of the template that they can fill out, and some national resources are also located there as well. Moving on. So the toolkit is fully accessible through the QR code that you've seen throughout the presentation. It links to the complete digital version. From there, nurses, clients, caregivers, anyone can download or print any of the forms, checklists, or templates. And it's also going to be available on the ANHE website. It can be introduced during routine home care visits where nurses walk clients through each section. And then the plan can be updated as health needs change. And this can be done in collaboration with case managers, caregivers, PCAs, family members, or even a local emergency management organizations. So all of this is going to help ensure continuity of care. The project and all of these materials, nurse facilitated model, it aligns with evidence from Hegel et al. Her studies were really helpful to me in looking at what was needed. And it really shows that when nurses actively teach preparedness, clients gain confidence and experience better emergency outcomes. Go on to our next slide. So ANHE, preparedness materials are only effective if clients can understand and act on them. And the Alliance of Nurses for Healthy Environments, ANNE, has been instrumental in connecting environmental justice to nursing practice. By integrating health literacy and advocacy, we can close the gaps that leave vulnerable populations behind. And this project reinforces ANNE's mission. It shows that preparedness is not just safety work, it's equity work, and everyone should feel confident and prepared when emergencies happen. In our next slide. So in summary, this project demonstrates how nurse-led interventions can dramatically improve preparedness for medically fragile home care clients. By using accessible tools, culturally tailored education, and environmental health literacy principles, nurses can empower clients to stay safe and independent during crises. So my hope is that this toolkit serves as both a teaching resource and a catalyst for policy change within home and community-based care programs. So we're moving on to our last slide. I truly want to say thank you for everyone for being here today and letting me present my project. Preparedness really starts with us as nurses, as educators, as advocates for our patients. We all want to ensure that no client is left unprepared. I'd also like to give special appreciation to Annie for their support, their guidance, and commitment to advancing environmental health literacy and preparedness for vulnerable populations. And I also want to say a special thank you to Kathy for being my mentor throughout this project. Her input has been invaluable. So at that point, thank you all again for coming. If anyone has any questions, I would be glad to answer them at this point.
Does anybody have any questions, comments? I think there's a couple things too, Lori, that we want to make sure people are aware. So the plan is for these resources to be put on the Annie's website. Right now, we're not exactly sure where, probably on the Education Forum site, but that's being figured out with any leadership. So the whole idea that Lori created this was so that it would be accessible for everybody to be able to use. And for those in academia, it might be a really good opportunity to share it with your students and have them really consider the patients they're going to see or the communities that they're going into as far as emergency preparedness from a clinical perspective. And I also think that we need to think about this very specifically when we're in the hospitals or in the acute care areas and we're discharging our patients. I've said this before, but when I was working in inpatient, a snowstorm had be coming. So we thought the best thing would be to send people home because, it's storm's coming. And they would be better at home. They would be more comfortable in their beds and those kinds of things. But did we forward think about could they get their medicine? What happens if the power goes out? The follow-up that we think is so important, can they get there? And we need to have those considerations for our patients instead of just discharging them and thinking that they're better off at home.
And I think to elaborate on that, this template that I put can all be kept in a binder. If they leave to go to the hospital, if they leave to have to evacuate, wherever they go, that binder can go with them. So they can say, this is my plan. This is what I have in place. And all of the tools, all of the information is accessible in one place, which is going to be really helpful to others that are also coordinating future care.
Yeah. And we've talked about too, because I come from a pediatric background. So my patient is a child always. Lori's apparently is always a grown up. But we have to think about, our nonverbal patients, our patients that maybe English isn't their first language, those that have difficulty communicating for whatever reason, and their family, their person isn't available. And maybe the PCA or the caregiver, the babysitter, whatever that person is, has to leave the home with, I'm going to say the child, but they would have this notebook, one thing, grab, and you'll have medical history, you'll have medications, you'll have that really a head start in providing care for that patient. And I think as well, it gives peace of mind to the family that maybe, the whole point of the waiver program is to provide care and respite for the family, and you want them to have peace of mind when they leave the house. And I think this is one more piece to give them peace of mind.
Kathy, this is Linda Perfetto. You all don't know me, but I've been Lori's faculty in the Capstone Prep and the Capstone Press capstone course, where she's worked really diligently on this project to get it to the point you just saw. I'd like to say to both of you, Kathy, you were a great mentor to Lori, and Lori, you took the ball and ran with it, and your presentation was excellent. My question is, what are your next steps with this? I know you said it's going to be on the Annie website.
So it is going to be on the Annie website. My next step is I have reached out to the 1199 Training Fund because they do a lot of training for PCAs that work with the waiver clients. They also have a new position and it's called a support and planning coach. The support and planning coach does do a little bit of emergency preparedness. However, it is a one-page sheet that says, where will you go in an emergency? Will you stay in your home or will you evacuate? If you're going to evacuate, where are you evacuating to? That's it. I would like to get my emergency preparedness toolkit to these support and planning coaches and hopefully be able to incorporate it in the 1199 training sessions that they do. So this could be used because it's more realistic. It includes everything that the patient's going to need versus a one page sheet that says, are you evacuating? Are you staying at home? So that's my future goal, is to try to work with them to incorporate that because they are involved with all of these waiver clients.
And Lori, you created a document that the layperson can complete. Yes, where nurses are well positioned to do this because they may be working initially with patients on a waiver program. But as you mentioned, it's not a frequent every Wednesday like a VNA nurse would be doing. So it is positioned for a PCA, a layperson who's going into the family to say, here's a document and you can do it to provide it and help them, but you certainly don't need to be a registered nurse to do so. And a lot of the questions are really kind of thought-provoking, like what would you do?
Yeah.
What, medications and those kinds of things. And Mary Ann Salvatore, who is listed as Kathy Murphy on the screen, has her hand up. So I'm going to defer, ask you, Mary Ann, what's your question? You're muted, Mary Ann. There you go. Nope. Just like, nope. Do you want to put it in the chat, Mary Ann? Mary Ann, like me, we live in Teams and not in Zoom. So, um, and Mary Ann is one of the amazing advisors at Charter Oak State College. And I thought it was important for some of our advisors, if they were able to come and see what the end result of all of their work is. Um, Mary Ann said, great work. And I do think it's important that this information be provided for patients to plant the seeds for that information as well. I tell people the story of a friend who lived in Florida when the hurricane was coming, but it wasn't supposed to come to the area. And then at the very last minute, it shifted. And so everyone from where it was supposed to go had left, but they took all the hotel rooms, they took all the safety in the lower area. And this family had to find a place last minute. I think they had about a day's notice, had to shore up their house as best as they could. They unfortunately left a neighbor who was homebound and couldn't be transported. And that was absolutely awful turmoil for them. And then they had to go really far to find a place to evacuate to, and that they could, the other issue was what they could afford. And so, a lot of our patients have limited funding. We have to consider what resources might go down in their, what you've left, what resources are available to them that are down. And what I want to say, an example of that is for this family was their medications, because we tell people to have a 2-week supply, right? If in case of an evacuation, they didn't plan for that. They had to leave relatively suddenly. So they didn't have 2 weeks of medication. Hypertension, cardiac disease, diabetes was a few of the factors. Didn't have the medications, and their pharmacy was down as well. So they couldn't get the meds that they needed in a timely manner. So there's a lot of considerations. At least if they had a book with all of the names, they might be able to get some help from a different pharmacist or that kind of stuff. But there's a lot of considerations here and very individualized from community to community. And like Lori said, where are you going to evacuate to? Well, if it's one answer, if you have a family member um, in the area, it's a different answer if you have mobility issues or if you have a service animal or something like that. And those are things that we need to take into consideration.
Yeah, and like you said, Kathy, with the prescriptions, a lot of with the smaller individual pharmacies, it's a good point because CVS may be national and you can pull up somebody's records, but if you're using an independent pharmacy, you can't necessarily get your information when if that pharmacy is also affected by the emergency. So having that list, having the dosages, having all of that information, at least you can present that to another pharmacy. This is what I take. These are my doses dosing. And then when they're reaching out to the doctors or whatnot to try to get them filled, they have something to go on.
And we do need to consider all of the other factors related to someone's health. You touched on things like oxygen, CPAP, those kinds of things. We need to think about diet for, common things like diabetes or kidney disease, those limitations. I'll go back to my Florida family. Um, Not a lot of funding. Where were they eating? The word non-compliant is so against the grain, and they all of their diet while they were evacuating was really probably the worst choices they probably could have made between the cardiac disease and the diabetes and those kinds of things. But it was what they could afford, it was what was accessible. If they had a go bag packed, if they had a plan, they might have had better dietary choices, at least some, maybe protein bars, maybe some low sugar options. I'm not saying it would have been perfect, but it might have been a little bit better.
Sorry,
Any,
it's Linda again.
hi,
Can you,
Linda.
hi, can you explain what the waiver program is? I'm not really familiar with it. I know you were, looking at home care clients, and could you just explain that a little bit
So
so I can understand it?
the waiver program was developed for patients who need would normally without this waiver program, they need daily care by a care provider. Without this program, they would be institutionalized either in a long-term, usually in a long-term care facility or say like long-term care facility or assisted living facility. The waiver programs were designed so they can hire their own caregivers to come into the home and provide that daily care. On average, some of them get the clients that I've had, they get between 40 hours up to 73 hours a week of care. And it's so they, can stay home and not end up in an institution.
Okay.
So that's what the programs were developed for. So essentially these clients, they're responsible for hiring their own PCAs and caregivers. Through the 1199, there are support and planning coaches. There are other people that go out to assist them. They sometimes will get a one-time nurse visit, but ultimately all of their care comes from the PCA that goes into
Right.
home daily.
And they're paying for that, and they're funded somewhat.
So they are giving they're giving a budget, and that budget pays for them. Yes, it's a state provided budget. It's a state program.
Right.
Linda, in Connecticut too, there's a program called Katie Beckett, which is for, again, the pediatric population. And it's really for respite. So it's very similar to what Lori was talking about. But it's to provide respite for families with medically complex children. And
right.
that's
You mentioned
where
that. Yeah.
yeah, that's where I always go back to, have the families have peace of mind if they leave.
Right.
Kind of deal. But the other thing is, in the case of an emergency, even, they would have this notebook if they had to evacuate or,
Right.
so it is multi-purpose. It really is. And the
Absolutely.
people that they're hiring, they might be PCAs. They don't have the medical knowledge of
No.
the meds. They may not be administering them. But to have that notebook could be really, really empowering and give them peace of mind.
And there's a section in there in the notebook as well that says like a daily care routine, their feeding needs, all of that,
Mhm.
in case there is a backup person that hasn't been to the home before.
Unfamiliar,
Because if
right.
you get a client that can't feed themselves, someone has to go there that day. And if they're
Mm,
sending a respite person in who knows nothing, and some of these patients do have communication issues, it's all written down for them. And
sure.
Yeah, yeah,
whereas
Looks
otherwise they're
great.
going in blind.
yeah. And I
Looks
think
great. Thank
too,
you.
Lori, as you progress in this project and when it's posted on the Annie website, and I encourage everybody to look at it, Lori's going to leave, she doesn't know this yet, I'm saying it, contact information so that if you have suggestions of how, because this will be somewhat of a living document on the Annie website with it, electronic modifications can be made. So that if you have suggestions for things that should be added, absolutely, we'll get it incorporated. And we're
Definitely.
hoping to have a component of this at least incorporated into the fourth edition of the e-text as well. And then the resources on the Annie website. Any other questions, comments? Are people seeing that this is a needed tool, usable tool? I'm saying yes. I'm being bossy. All right, if there's no other questions or comments, I want to thank Lori for sharing this information for everybody. Be aware that there'll be some kind of an announcement. I'm expecting trumpets when it's available on the Annie website. And again, we appreciate any feedback that you would have to provide Lori as this continues to grow and be utilized by hopefully many, many people. Thank you very much for coming. Hannah will be sending out a post test so that contact hours can be provided.
Thank you.
Thank you, everybody.
Thank you all for coming.
Mary Ann, I see your hand up.
Can you hear me?
Yes.
Oh, great. Perfect. Yeah, I just want to say thank you for inviting me. I really appreciate it. As an advisor, it's really nice to see the culmination of the program and the capstone project. And this was really informative. And not coming from a nursing background, I can still appreciate why this would be so helpful and useful. So thank you.
No,
You're
thank you.
very welcome.
And
Thank you.
Mary Ann, I bet you can kind of see the little pieces of the different parts of the nursing courses, research, leadership. I forgot what the other ones are, but don't tell on me. But you can see the pieces of all the different courses, how this scaffolded into this final project. So,
Yes. Yes, definitely. Yep.
I appreciate you coming very much, even though you are impostoring me.
Yeah.
I don't know how that happened. All
I
right.
don't know.
All right. Thank you,
All right. Thank you again, everyone.
Lori. Nice job. Awesome. All right. We'll talk soon.
All right. Very good. Bye-bye.
Bye.